Hello and welcome. We're talking tonight about a big topic about integrative medicine. My guest tonight is a clinical health psychologist, Dr. Mark Weisberg, who is back with me. He's been on several times, one of my favorite guests. You are a community adjunct professor now with the Center for Spirituality and Healing at the U. He's also a consultant and co-owner of the Minnesota Head and Neck Pain Clinic. And I know you have 4 clinics around the metro area.
Right.
He has provided consultation to staffs around the country, including, and this was most impressive, to Andrew Weil.
To their program, the Center for Integrative Medicine at the University of Arizona, yeah.
People who are in integrative medicine know that name. You train people in psychoneuroimmunology. You teach an online education course.
In mind-body medicine.
In mind-body medicine.
Yeah.
Very busy, busy man. I was asking Mark how many hours of sleep you need, and you said you need 8.
Yeah, I still do.
You're doing well to get it all in. Well, you and I were just comparing notes in terms of defining integrative medicine compared to complementary medicine, compared to alternative. Do you want to just run us through those 3?
It's an important distinction because alternative medicine, which kind of emerged first, as the name implies, came up as an alternative to standard treatments. So I'm thinking back of when they were looking at using Laetrile as an alternative to using the common cancer chemotherapy and radiation and surgery. As time progressed, they changed the term to complementary, which then meant let's do standard treatment, but then let's add something like acupuncture to it while we're doing the standard treatment. The biggest revolution in the field has come with what we now call integrative medicine, which is taking a scientific approach to look at what are the best standard allopathic treatments and also the best complementary treatments, evidence-based, and combining them. And in addition, it's an orientation that takes into account that the patient has their own self-healing resources that we need to catalyze and activate for maximum healing. So that's really been the progression that's led to integrative medicine now.
You said to me earlier also that there is actually pretty good research out there that backs up complementary medicine, integrative medicine, and yet I think there is kind of a assumption, perhaps, Mark, in the country that it's still controversial, that it's not based on research, that it might work, but Western doctors are leery of getting their patient involved with it?
Well, part of it's a training issue. There is a consortium of medical schools now that actually include integrative medicine training as part of the curriculum. I've been involved with setting up some of those curricula, in part with the program in Arizona, and have been in touch with the program here. But part of it is educating the public as well. Integrative medicine really does have a scientific foundation. That's part of the basis of it. And I think the reason why this is so important now is if you look at our health system as a whole, although it's called a healthcare system, it really is a disease care system. Our system is the best in the world for treating acute illness. So if someone has a heart attack or a stroke, our acute care is the best in the world. But for chronic conditions, be that diabetes, chronic low back pain, chronic headaches, chronic digestive problems, a lot of people really fall through the cracks because the treatments that we use for acute care do not work as well for chronic conditions. And that's where integrative medicine is gaining popularity because it works better.
Do you think, too, maybe one of the human reasons that chronic illness has fallen through the cracks is that it kind of wears doctors out? They don't see their patients getting better. They know they may have, let's say, arthritis for the rest of their lives. Doctors want to cure and want to treat, and with chronic illnesses, often they can't.
It depends whether the physician or the psychologist or the dentist or the osteopath is taking a old traditional or an integrative approach. The old approach, you can really call, it's find it and fix it. Where's the broken part? Do something to fix it. We all feel more gratified when we can do that. In a chronic condition, it's more complex. And the clinician has to be open to the fact that the healing is a process, and that healing might not be total alleviation of the disease. It might be getting the patient to where they have less severe symptoms, more quality of life, more able to do their daily activities. So that is a mindset change, and also it's a paradigm shift.
How so?
Well, a number of years ago, I think the average layperson would go to their care clinic hoping to get fixed. You know, if I have a pain, if I have an illness, a disease, I want to go there and have it medicated or cut out and have it be done. There's increasing awareness now that in this new paradigm, the patient really has to be more responsible for their own care. That doesn't mean they're to blame for their illness, but it does mean that with chronic conditions, one of the biggest tasks that we have as doctors is to let patients know that they have things that they can do that can make a tangible difference in their health and in alleviating illness.
Can you give us an example, Mark? Let's say with diabetes, one of the major chronic illnesses in our country.
Sure, sure.
What would be some self-healing kinds of things that an integrative medicine doctor might recommend?
Sure. Well, in type 2 diabetes, of which there's been just an incredible epidemic in recent years, obviously two of the big factors that make a difference are diet and exercise. And to the extent that people are hoping to take a pill and have that make it better, it's very limited. And so a lot of people know intellectually, yes, I know I should have a better diet. Yes, I know I should have less simple carbohydrates, less sugars. Yes, I know I should exercise more. But many people have a hard time making those changes.
There's a but there, isn't there?
Very much so, very much so. And unfortunately, some people have to get very ill before they have the motivation to do something different. And I think the role for all of us in the integrative medicine field is how to motivate patients earlier in the process to be interested in doing more to take care of themselves.
Are doctors who are more traditional, are they aware that you've got some ideas up your sleeve, so to speak of?
Well, I think
in this arena, in terms of motivating patients?
I think the literature on integrative medicine is starting to grow. And I can't remember if I mentioned to you on camera or off camera about the number of medical schools now that are including integrative training in their curriculum. So as medical students become residents, as psychology interns go out in the field, as osteopaths and others go through their training, they now have some more awareness that there are these other empirically based treatments out there. So little by little, the momentum is increasing. I think another factor, Mary, that's lending to the rise of integrative medicine is the baby boomer generation. As they age, as we age, the baby boomers are used to having more choices. And they came up in an age where psychological factors and behavioral factors affecting health was more commonplace than in previous generations.
And they don't look at their doctor as the only authority out there on the topic.
That's part of that paradigm shift.